My name is Kevin, 33 years old, born and raised in San Francisco, California. Decided to come see Dr. Delgado based on a problem that I feel I've been holding in for many years, which is gynecomastia.
My name is David Moore, and I'm seeing the doctor today to talk about possibly having a treatment regarding my gynecomastia, my condition that has to do with my chest.
At the age of maybe 8 or 9, I do remember I was flat-chested, and then something happened. Then my chest area perked up. It perked.
Gynecomastia is a condition where men or boys develop female-like breast. It can be from a slight puffiness underneath the nipple to the extreme of 48 triple D and larger breast. There are certainly many men who wear bras on a 24/7 basis as a consequence. Depending upon the degree of impact, how it's handled by family, by teachers, by coaches, by peers, will have a great deal of impact upon how this boy learns to deal with this, or the interventions that subsequently come via hiding it with clothing all the way through surgery.
I would say my interest in gynecomastia first started probably 7 or 8 years ago, when it was really before it became a real common thing, or as popular as it is now. It's cosmetic surgery, but it affects these people's lives almost like a reconstructive procedure can change a person's life.
I felt at first it was just chubbiness, or normal course of being a little overweight, and something that should eventually go away.
Started when I was about, I'd say 12 years old or so. Started with just one of my nipples being really hard and sore, and just that's the way it started. And I didn't know what the hell was wrong. I was a little kid. I had no clue.
You take off your shirt and you have friends kind of pointing and laughing and saying, where's your bra?
It just didn't look right. And then there were those that validated that it didn't look right. So when I went to the Navy, validation was, man, you look like you have titties.
It disgusts me. I think it's disgusting, and it makes me angry. So that makes me angry that I look that way.
So you learn to live around that situation. You learn to mask it as best you can. And so for me, what I needed to do was wear tight shirts. What I needed to do was never go to the beach. What I needed to do was never go swimming.
It's depressing, it is. It's something that you wish that you wish that really it is only in your eyes, and you could work on it internally. I've never had a long-term girlfriend, and I would say the longest is about 8-9 months.
When I was a teenager, I would have done anything I could do to get rid of the way my nipples looked. I remember at times I was even getting knives and trying to cut myself, just to try to see if I didn't know what the hell was going on. I just wanted to be normal.
Gynecomastia is a term that a lot of men don't know about. They're more hearing things like girls' tits and bitches' tits, and all these terms that you hear about, or slogans that are very embarrassing, or what guys really know it by. But gynecomastia is the real term, and it's basically male breast enlargement. Kevin.
Hey, doctor.
Good to meet you. And obviously you're here, about your chest. Can you just tell me a little bit about that? What bothers you?
Sure. I feel I've had a problem with the chest area that for many years, from I would say adolescent on. It was something that I felt that was kind of part of growing pains, or being chubby, or something that would go away with exercise. And after years and years of just basically trying and seeing my body develop, I found out that it seems to be here to stay. Over the years, I've had the, he's got, man boobs, a few comments that it was enough for me to know that it's easily noticeable, and it was something that I wanted to avoid hearing.
How about your partners? Is there an issue?
I've never had long-term girlfriends. Some of it has to do with just me opening up enough and being intimate enough for a long period of time with somebody. I would say some of that has to do with the self-consciousness I have of my body, and it's prohibited me from kind of really opening up and settling down with somebody. I definitely shop to find clothes that not are only loose in the chest area, but have areas around it that may take the eyesight away from it. Big collars, big shoulders. If it's suits, if it's jackets.
Jerome.
Yes.
I want to show you some pictures about what you can expect. I'm going to show you good outcomes. I'm going to show you not as good outcomes. I'm going to show you problems that happen because the skin doesn't contract. So here's a guy too. Nice contraction of the skin. He's got a large areola. It shrunk down quite a bit. The incision you can hardly see. So it's got a very nice outcome. Younger man, so the contraction's better. Let's go through. Now here's a patient where the areola is stretched.
Yes.
It's stretched out from the tissue behind it, so it's thin.
Yes.
So I know that's not going to contract as well. And I tell guys, because I've done enough of them, you're going to have a problem with your skin not contracting right. You always have to look at what you start with.
Absolutely.
And where you are.
Yes.
Liposuction of the axilla from the back.
Yes.
And if you don't do that, you end up getting this fullness out here, because when you're laying flat on the bed, the fatty tissue falls back and you can't extract it well. All these guys have a certain amount of gland involved, so you have to surgically remove that, in my opinion, to get a good outcome. You can see nice contour, nice and flat. You can see how full that is. You can see how flat that is, and how it's nicely contracted. The point of what we're doing here is to show men the reality of this, and that there are solutions to it. That it can be successful, but there can be hurdles along the way. And here's a guy. You can see he's like a C cup here. I know he's going to have some skin issues. I can look at him and tell.
He looks pretty decent right here.
He looks good. He's got a little fold here. Got a little folded tissue here. There's none here. He's smaller on this side, less skin. On this side, he has more skin, so I'm not getting as much contraction. So I can improve that.
If the outcome is anything like I'm seeing here, it's a win-win.
Yeah, it's a win-win.
It's a win-win anyway.
I just want to show you some pictures of some before and afters. See, afterwards, we've trimmed it down, we've contoured it, the incisions, are good. His overall shape has a nice contour to it. Here's a guy who we saw, this is a year later. He had liposuction and glandular excision and ultrasound of his chest, but you see how now his pectoralis you can actually see here.
Oh yeah.
I like showing this because of the power of contraction of the skin. Look how much it contracted down.
Wow.
I mean, that's with an incision this big.
Wow.
And so, of course I tell this guy, well, you could have a contraction problem. It may not contract as much down as.
So did you have to cut his nipples at all?
Yeah, no, just the incision, just
Really?
one little incision.
Because look at the size difference.
It's
That's
amazing. Yeah.